Well, it's business as usual at hospitals up and down the country as they continue to treat those affected by COVID-19. Let's speak now to Sky's Inzamam Rashid. He's live outside the Royal Preston Hospital. Merry Christmas to you, Inzamam. We're always looking at hospitalisation rates. What's the situation like there?
Well, Kimberly, welcome to Royal Preston Hospital. This is a COVID ward that we are on, part of the red zone and the blue zone. This ward has patients with COVID-19, patients with the Omicron variant as well, and in particular patients who haven't been vaccinated or potentially have one dose of the vaccination. There are some very sick people on this ward in the Royal Preston. There are around 40 or just over 40 patients with coronavirus at this hospital. A number of them haven't been vaccinated, and there are just over, I think the doctor earlier telling me, about 5 or 6 who are in the critical care unit who are incredibly unwell on Christmas Day with COVID-19. What we will do shortly is speak to Dr. Mohammed Munawar, but this ward, I just want to tell you, features some very, very ill patients, and we've been witnessing incredibly the work that doctors, that nurses, that staff who are here also on a temporary basis filling in on Christmas Day because of the number of staff that are off sick with COVID-19 have been working incredibly hard. But let's bring in Dr. Mohammed Munawar, who is the lead here of the respiratory unit. Just tell us the situation currently right now at the Royal Preston Hospital that you're facing, Doc.
So COVID-19 is continuing to cause problems for us. Unfortunately, we are in the COVID respiratory ward, which is the main area where patients with lung problems related to COVID are admitted. And about half the ward is taken over by COVID patients, and that's why COVID causes us problems in many fronts. One, because we do not have enough spaces for the other lung problems to be treated, so the treatment of those patients who do not have COVID but other respiratory problems gets delayed, both in the inpatient as well as in the clinics. Besides that, if you go around the hospital, we have COVID patients who are seriously ill in our respiratory high care as well as in critical care unit. And as you get to the severe end of the spectrum, you find that younger and unvaccinated people are those in that group. So quite clearly, COVID is causing massive problems for those people who are unvaccinated or incompletely vaccinated. And that's why it's so incredibly important that people get vaccinated immediately as a matter of urgency, and get boosted as well.
I was going to ask you a bit about the makeup of patients on the ward. You said a lot of people unvaccinated, a lot of young people as well. So what are the conclusions that you're seeing of people who are becoming sick with COVID in the hospital?
Yeah, people who are unvaccinated or incompletely vaccinated become extremely ill very quickly. The oxygen levels plummet all of a sudden, matter of minutes to hours, and then they end up requiring either the CPAP, the hood, or even ventilation. And so they are the people who we are most concerned about, because they are at the greatest risk of developing very severe illness and even succumbing to the illness very sadly, which we have seen, unfortunately.
And Doc, what are the pressures that you guys are facing right now in the hospital? Omicron is spreading rapidly. Yes, there is a big vaccination program happening outside of these walls, but a number of your staff members are also falling ill to COVID-19.
Yeah, throughout the pandemic, our colleagues, the nursing, physiotherapy, radiographers, everybody have done a phenomenal job. But what we are seeing now is a number of people contracting the infection or having to isolate. This is proving to be a massive challenge for us. In the last few days, several of our colleagues, the staff nurses, doctors have fallen ill or have had to isolate awaiting results, PCR, etc. And therefore, we are struggling from that point of view to ensure that there is safe staffing. A number of people have come out, left their Christmas celebrations, left their families, and come to help out, which is quite simply outstanding.
And are you concerned that if the situation outside, in terms of potentially vaccinations and even restrictions, if there aren't restrictions implemented, that you could be overwhelmed once again in your hospital? Is that a worry for you?
Definitely. Perhaps I should also add it's not as bad as it was last Christmas when we were here. And thanks entirely to the vaccination program. The main thing to do is to get vaccinated, boosted, but following that, continue to manage and to adhere to COVID-safe precautions. That is crucial. Continue to mask, social distance, and if you're meeting anybody indoors, do an LFA in advance to ensure it's safe for everybody around you. But vaccination is key.
Are you worried that things could become worse in the coming weeks? Is that something that you are factoring in? Is that a major concern for you?
Potentially, because with the Omicron spreading as it is at the moment, more transmissible, and there's a danger that older people who are more at risk, people with comorbidity, other medical conditions, could get affected and therefore end up requiring hospitalization. But the bottom line is we still see unvaccinated people, sadly, coming in, and then they beg and plead to us to get them better. But by the time they have had the infection, if they're unvaccinated, they come in very seriously ill, and despite all the treatments, we have better treatments now compared to a few months ago, a year ago, and we can do more for patients, and we try our very best. But despite that, some people continue to deteriorate, and those people do well if they have had vaccination. People who have had vaccinations have come in, have shorter illness, so then they tend to go home quicker, and they don't usually require critical care admission. There are a minority who have required critical care admission, and those are the people who haven't had their second dose more than 6 to 8 months ago, supporting the evidence that boosters are required for that group of patients.
Just finally, we are on a COVID ward here. There are some very sick patients. You only need to look through some of the windows in order to see that. How much of a concern is it seeing people so unwell with COVID still? We are, way into this pandemic now, and still people are suffering.
Yes, that's a reality. Unfortunately, despite everything, we have seen some people still getting very seriously ill. But as I said earlier, I think it's a much better situation thanks to the vaccines. So vaccines are indeed the most effective weapons to battle, to combat, to survive this pandemic. And so we need to get everybody vaccinated, everybody boosted, and continue to wear a mask out there when you're in an indoor environment particularly. Continue to practice all possible COVID-safe precautions.
Doc, thank you so much. Really do appreciate your time. I know you're doing a brilliant job here, especially over Christmas with limited staff as well, and thank you for allowing us the access here today. Clearly a message from Dr. Manavra there that vaccinations, as someone who is on the front line, is key. That's what he is saying, that people need to be vaccinated, and that will suppress the emissions here into hospital and will hopefully protect them in the days and the weeks to come. As I mentioned, a very busy ward in terms of the number of people on here, and hoping that the hospitals here hoping that won't increase in the days and weeks to come. But a Christmas day in a hospital, not like any other COVID patients, and precautions have to be met, red zones and blue zones with COVID patients, and a number of staff having to come in working on Christmas Day when they didn't expect to, because there are others who have called in sick as well. So not a normal Christmas whatsoever, but the doctor saying one better than last year, but still huge caution to deal with in these hospitals.
Okay, Lindsay, thank you so much.